All right, good morning, everybody. So I am going to quickly go through the second lecture for Module 1 that's on how to develop a research question. Figured this would be helpful for you guys to start moving forward with a few different assignments. So the first one, the assignment 1, which is related to finding a couple of research articles that have an interdisciplinary spin to them and trying to identify the research questions in those papers, try and identify the objectives, and try and understand the strengths and weaknesses of its interdisciplinarity. So that I thought would be helpful having this lecture first. The other is you guys should be thinking very seriously now about assignment 2, which is the grant proposal, sort of the short grant proposal that you're going to submit for both 5901 and 5902 at the end of the module, as well as your proposal for your thesis. Okay, so all the things we're going to talk about today are really relevant to all of those assignments. So what we're going to start with is just sort of a little bit more of an elaboration on what I mean by interdisciplinary research, because this is certainly a concept that I find that students struggle with quite a bit as they come into this program. Even though you've all signed up for a master's in interdisciplinary health sciences, we certainly find that most people don't actually understand really what that means, or they think they do, and then when they try and go out and actually look for research that is truly interdisciplinary, they really struggle with trying to identify what they're looking at. So the one thing you need to think about, and you can look at yourselves and you can look at your supervisors as sort of role models in this way, is interdisciplinary research is typically done in teams. And that is because not all of us can be experts in everything. So it is totally fine that you are approaching your thesis project or your supervisor's approaching their research program with a discipline-specific base or foundation, but that they are integrating themselves within a team of other researchers who are coming from other disciplines, and that this group, this research team, is really working together in a very interdisciplinary fashion to come up with novel research questions, to come up with research designs that are really taking into consideration perspectives and attitudes of the different disciplines, that they're collecting data together and they're sitting down once the data is collected and trying to analyze it together. Again, so all the perspectives and expertise are at the table for every step of the research. So as your part of your assignment 1, you need to go out there and actually find a couple papers that are doing interdisciplinary research. And I've already had one question from a student in regards to how do I tell if a paper is actually talking about interdisciplinary research. And there's a few things that you should be looking for that should sort of raise a flag that, yeah, this is probably a form of interdisciplinary research. Whether it's good or not is what you need to sort of try and assess in your assignment. But first and foremost, obviously, you're going to be reading the title of the paper. And so if we just look at this example here, it looks like we're talking about an exercise intervention program and cardiovascular risk factors. So already we're looking at sort of exercise physiology as well as intervention type studies, cardiovascular risk factors, depending on how they're assessing those. This could be a biomedical or it could be an epidemiological type spin. They're specifically looking in obese children. And in fact, they're looking, if you read further on, at a school-based program, which includes individualized diet counseling. So there's actually a nutritional spin on this as well. So certainly just reading the title, it looks like there's quite a few different concepts and possibly disciplines being brought to the table in the development of this study. The next place you want to look is your list of authors, which comes right afterwards. And this sometimes requires a little bit of homework on your part. Sometimes it's nicely listed what their affiliations are, but sometimes you just need to do a quick Google search to try and find who these people are and see what their actual background or expertise is. So when I did that, when I just did a quick search and looked at some of these people, we have here a pediatrician. I'm just realizing there's a spelling mistake there. So you have an MD pediatrician who focuses on nutrition in pediatric populations. Over here we have a PhD in biochemistry who works primarily on inflammation and chronic diseases. And here we've got a PhD in sports science, so looking at physical activity. So certainly at least on paper, you have people who look like they're bringing to the table a variety of different sort of discipline-specific expertise that are going to be very complementary in the development and execution of this study. So if we take a look at this study in a little bit more detail, and I have to apologize, in order to get Google Hangout on air to work, I can't actually launch the slideshow. So this is supposed to be animated and coming up bit by bit, but that's not going to work for us today, unfortunately. But let's look over here on the left-hand side. Over here, as you take a look in this study, they very specifically, usually the last paragraph of the introduction of a study is going to very explicitly tell you what the aim or the study objective is. So in this case, it's to evaluate and compare changes in several cardiovascular risk factors, and those they identify as body composition, blood pressure, lipid profiles, and glucose metabolism in two different groups of children. So those who received that individualized diet counseling and those who did not. And that they were going to be looking at these risk factors over an 8-month period during which these students are involved in this school-based intervention program. It's very specific. We have a clear idea of between the title and what I've sort of cropped up here, who the study population is, what the interventions are, and what types of outcomes they're looking at. And you can imagine that there is probably some interdisciplinarity involved, because certainly there was a certain discipline involved in coming up with this individualized counseling approach, specifically if it's related to nutrition. There's going to be sports scientists involved in trying to develop these programs. There's going to be some clinicians and some biomedical scientists who are going to be involved in doing these different cardiovascular risk profiling. And then certainly we have to put all of this together and do sort of statistical analyses on these, which may be done by these different individuals, or maybe I didn't take a look at everyone. Maybe we have somebody else on board who has an expertise in statistical analysis. If you look over on the right-hand side, this was pulled from the methods section of that paper. You can see that they go through all of the different types of measurements that they're going to do. And again, you can see that this really spans a few different disciplines in regards to the types of expertise you would need to do to either develop a physical activity intervention program, to do the clinical monitoring. This is a body composition assay, which you see, so in HK, for example, we've got the ability to do that over at Leeds Avenue. We have a DEXA machine. And then blood sampling for lipids and lipoproteins. That could be done in a variety of different wet labs. We could do this, for example, in my laboratory at RGN. And here was the conclusion of that study. The conclusion was that school-based interventions can be successful in promoting healthy behaviors, promoting physical activity and an individualized support system for children. And not only can they change habits, but they can trigger physiological changes. So when they measured these risk factors for atherosclerosis, they were showing improvements. And now I've got, I think, 2 or 3 more examples of some studies that I just quickly pulled. Again, where if you were to sort of look at the title up here, the expertise of the authors, and even just sort of a quick scan through the abstract, you should be able to have a sense that, yes, in fact, they are using sort of mixed methods that span a variety of disciplines or approaches, so a combination of quantitative and qualitative research. So, for example, in this study, they were looking at sort of the accuracy of self-reported sexual behavior in an HIV population. And they were comparing sort of self-reporting through either surveys or face-to-face interviewing. So those are qualitative research methods. And they were comparing them to objective quantitative measures using a biomarker for semen exposure. And so they talk about how they did both of these sort of methodologies in tandem, and then they were able to compare the two of them. So clearly you're going to need expertise for qualitative and quantitative biomedical research to be able to complete this project. Here's another one comparing a very similar, where they looked at a panel of biochemical biomarkers that would be sort of measured in a wet basic science laboratory. and compared them to a child behavior checklist to sort of look at whether we could identify circulating biomarkers which might identify psychopathology in children. And then another one here in regards to whether there's any genes that they could identify that were associated with a variety of different parenting behaviors. I'll let you guys read through those. I think it's important for you guys to be able to read these abstracts and sort of identify what types of disciplines might actually be involved in the execution, not only the execution, but the development, the application and execution of these different studies. So interdisciplinary research has lots of goals. If it's done right, it can be highly successful. And that's because it allows researchers to ask big questions. It can ask questions that really span more than one discipline. So, I went to school, got my master's, got my PhD, did a couple postdocs, got highly specialized in what I do. And I certainly on my own can answer questions in my very sort of small field. But when I want to think big, which I've really started doing a lot, I need expertise from other domains on board. And that's where interdisciplinary research has its biggest sort of merit, is allowing you to ask questions that couldn't be asked on your own. It allows the people involved in research to learn quite a bit about other disciplines. So I find it extremely rewarding working with people in other disciplines because I'm learning about stuff. This is sort of a continual learning process for me. I'm always learning about different fields that are related to what I'm interested in, the types of methods that they use, the sort of lingo that they use, applications that I knew nothing about. I work a lot with clinicians in a variety of different fields. It gives me a lot of insight into sort of the running of a clinical institution and how the research that we're doing can be applied in a clinical setting. It allows you to really look at similarities and differences across disciplines. So as I said a couple times now, really people coming from different disciplines often bring very different perspectives to the table. And often that is used as a reason to sort of shut down interdisciplinary research. But if you actually can open your mind to the idea that some of these perspectives are very intriguing and are worth considering, it really can make research quite rich. And why this is so applicable to health science is that there are certainly problems in this world, and health and disease are certainly fall into this category, where there is not just one single cause, there's not just one simple answer, and instead an interdisciplinary approach is absolutely necessary to fully understand and make change, and health is certainly a candidate for that. So as I said, I've just sort of praised all the wonderful things about interdisciplinary research. It isn't all hunky-dory. There are still issues. We are making tremendous strides. But as I mentioned last class, there still remain some hurdles in regards to finding funding, where you have the old school researchers who are still really entrenched in a discipline-focused approach, but that is certainly changing. It was quite challenging to get a lot of this type of research published within the past 10 years. Again, that has changed quite a bit, and even more so in the past couple of years, where you're actually starting to see the development of high quality interdisciplinary focused journals. So they're looking for this type of research to publish. So one way that sort of if you're thinking big picture, if you're thinking about your grant proposal, for example, one way to really ensure that interdisciplinarity can be weaved into a project is to make sure that the stakeholders or the end users of the research that you're doing play a role in the development of the study. And the reason that we encourage that is because many times the stakeholders or the users, who may be, for example, patients who are going to receive the intervention, it may be the different healthcare providers that you're going to be trying to coax into using these different experimental approaches that you're coming up with. It could be policymakers, you name it. Those are all sort of the end stakeholders. These individuals don't necessarily come to the table with a discipline-focused mentality, and instead they're coming with more of a real-world approach to the problem. So if you have them involved from the get-go, you can really ensure that you've got interdisciplinarity across the board. You have a lot of focus put onto the real-world problems, and you have a higher rate of uptake. So if you have the people who you need to actually implement the research at the end of the day involved, it's much more likely that it's actually going to be implemented. All right, so let's move on to research questions, because that's going to be the biggest thing that you guys will be working on over the next few weeks, is developing your research question for your grant, but also for your thesis proposal. So how do you actually go about coming up with a research question? Well, typically, research questions are deduced from existing theories or existing observations of the world around you. So these could be clinical observations. So let's say you see an observation in the hospital that, for example, individuals, young people with mental health issues are not getting treatment within a reasonable time frame. So this could lead to the question, what are the barriers that are preventing these individuals from making it into counseling or making it into these intervention programs in a timely fashion? Sometimes research questions are brought about by previous research. So, for example, in my research laboratory, we are always doing research, and we always sort of come up with answers to the original question. But typically, as we're doing it, more questions arise. So we may have one answer, but we've sort of uncovered a variety of other questions along the way. Sometimes some of the research that's done is inconclusive, so we don't have a solid answer at the end of the day, or maybe we realize that there was errors in the way that the study was designed or executed, or maybe it wasn't totally complete or appropriate to all the different patient populations that we might be interested in. And that could lead to the development of a new research question. Maybe in some cases we're looking at certain interventions that are currently the gold standard. So certain tests that might be used, or certain drugs that might be tested or used for a variety of different things. And maybe we have some concerns about whether they're safe or effective. And so we may have a question and design a trial trying to assess whether that is actually true. And maybe it's related to very pressing problems that we're currently facing in our healthcare setting as well. So when you think about developing a research question, really, I want you to sort of think about an inverted pyramid. So at the very front end, you're going to have context. And context really is referring to what is overall the broad area or the broad topic that you're interested in. So you guys have all selected a master's supervisor and a master's topic. So certainly I am hoping that was pure interest that drove your selection of that area. And so you have a really good idea of the context or the area of interest that you want to do research in. You, over the next few months, are going to be doing a lot of reading of the research related to your thesis topic. And you're going to be learning sort of the ins and outs of what we know, what we don't know. And hopefully you're going to be identifying some pressing questions that you think are really interesting. So questions that might address gaps in knowledge, questions related to something that maybe has never been considered, questions related to work that's been done previously, but you don't necessarily trust the results of the work that's been done previously. So that's where you're going to start generating your research question. What is it that I actually want to know in this broad topic? What is really interesting to me? So you'll come up with this question, but that's not where it stops. Not all questions are good questions. Some questions are good for you, but they're really not good for funding agencies, for example. So you need to be able to ask yourself, why is my question important? So why do I care about my question? But why would other people care about it? Why would the Canadian Institute of Health Research care about it so much that they would give me money to actually do this experiment? Why would patients care about it? Why would other healthcare providers care about it? Why would other researchers care about it? You need to be able to answer those questions about your research question to determine if it's a sound question or not. You should have already been in the literature, but again, once you have what you think is a good research question, you need to very specifically go back to what types of research has been done already to hammer out for sure what is already known and what is already not, or what is not known. Has anybody tried to answer this question before? If the answer is no, that's great. That's novel. It's very exciting. The problem is a lot of research questions have been asked before. So likely what you're going to find is some research in which people have tried to answer your question or parts of your question or a very similar question. And what you need to ask yourself is what the information that will gain if I execute my experiment, how will that contribute to what is already known out there? Are we just replicating a study for the sake of replicating it? Or are we replicating a study or replicating a question because it wasn't asked properly? Or it was asked about a population that is not relevant to the population of patients that is seen here in Ottawa, for example. And then the last thing you need to think about are the implications. So let's say you can convince people that your research question is very important. You submit a proposal and it gets funding, you get a bunch of money. You go and you execute your experiment and you get results. What, at the end of the day, will be the implication of executing this research? What will we know that we did not know before? What will change in clinical practice? What will change in our perspective of healthcare? So you need to think very, very concretely about what types of outcomes do you actually think are feasible through the execution of that research question that you might have. Hulley et al. Have proposed the finer criteria that you want to be thinking about when you're developing a research question. So some of these things, hopefully your supervisor and your TAC committee members will be constantly thinking about in regards to your thesis, and you should also be thinking about those. But when you're trying to prepare your grant proposal, you won't have anybody other than yourself to really tell you whether your research question is 100% reasonable. And so that's where comparing your question to these bullet points might be very important. So the first thing you want to ask yourself is my research question feasible? Sometimes you can have these amazing ideas, but at the end of the day, there's just really no way that with the amount of research and money that is available to you that you could actually get that study completed. So, you have to think about things like how many patients you actually would need to see in order to execute the study. So for example, if you were very interested in a very, very rare genetic disorder where 1 in 50 million kids are getting this disease, is it feasible that you could actually conduct a study here in Canada with a reasonable amount of money and time to actually understand what's going on with this disease? Do you have the adequate technical expertise to get this study done? So this is going to be very important for your grant proposal. You need to make sure that if you don't have the expertise, that you are bringing on board individuals who do have that research expertise to get the question completed. We've asked in the short proposal and in your full grant to have an idea of timeline. And that's because we want you guys to really think hard about whether this is reasonable to get done in a reasonable amount of time. Typically, CIHR grants are anywhere from 3 to 5 years in length. So can you actually answer your question in that amount of time? So think long and hard about the reality of that and how much it might cost to do so. And is it manageable for one person to be executing? What size team do you actually need to be able to answer this research question? Last week, we talked about whether this was actually an interesting question. So clearly it's going to be interesting to you, but you need to ask yourself whether it's interesting to anybody else. And if the answer is no, then this is probably not a research question that would be funded by a federal funding agency. Is your question novel? So certainly if it's brand new, that's wonderful. Nobody's ever done it, great. Chances are that's not the case. So if it isn't entirely brand new novel, you need to ask yourself, what is it about this research question that is of interest? So is it confirming previous research, or is it refuting research that was maybe done poorly? Is it extending findings into very, let's say different patient populations? So you need to be able to explain what aspect of your study is in fact novel. Ethical, I think Isabel in 5901 is going to be talking to you guys a lot about ethics in research. you need to think, you again could have a wonderful research question, but is it actually feasible and ethically feasible to do it? Would our research ethics review board approve your study? So I work in obstetrics. I work in a field that is very hard to get ethical review. So this is something we have to consider a lot. Would a mother sign up for an intervention that has never been tested on humans before and possibly put her baby at risk? The chance is probably no, and ethics review boards are going to see that and not approve a study because of it. So you have to think long and hard about the ethical considerations of your study. And how relevant is it? Are you studying something that is a really sort of a hot topic right now that's contributing to scientific knowledge that we really need at this current time? Or are you studying something that was really hot and interesting 20 years ago, but everybody has really moved on from it at that point? So really sort of think about that and think about what types of future research this might spawn off as well. Last week I talked to you about PICO. So this is the way to really formulate your research question. So each research question should have 3 or 4 very specific items that are listed. So P stands for problem, and this is either the group of people that you're interested in or the disease, maybe in some case that you're interested in. The I stands for intervention, but really what we're referring to here is the study parameter. So this could also be an exposure. So let's say it was exposure to pollution. That could be the intervention that you're then looking at an outcome later on. Sometimes you're comparing 2 types of exposures or you're comparing 2 types of interventions. And in that case, you're going to have a C in your research question. So this is going to be the alternative that's being tested against. And O is ultimately the outcome that you're interested in, the outcome that you're going to measure or assess or look at. In some cases, people are very interested in a specific time period, and in that case, that should be built into your research question as well, but it's not always relevant. So I've put this template, template document in here for you to try and help you as you are coming up with research questions, again, for either your assignment or your thesis proposal. So you have to first and foremost think of what type of research question you're trying to ask. So are you asking about an intervention? So what treatment might be leading to a better outcome? Are you asking a question about etiology? So what is a good risk factor or a cause of a condition? Are you interested in diagnostic tests? So comparing the accuracy of 2 different diagnostic tests in a healthcare setting, for example. What about meaning? You could be very interested in meaning, so understanding an experience of a particular individual. Well, over here on the right, you have your templates where they've essentially started the question for you. And what you need to identify is your P, your problem or your patient group of interest, your intervention or your exposure, your comparison if there is one, and the outcome of your interest, a time frame, if it's relevant, and just plug it into here, and then you've got a really solid PICO question. And so what I've done here is I've actually just given you a bunch of examples for all these different types of research questions, where I've highlighted what the P, the I, the C, and the O are, to sort of give you concrete examples of what I mean. So if we just look at the first one, an intervention, in this case, my patient population that I'm interested in are African-American female adolescents who have hepatitis B. The intervention I'm interested in is acetaminophen, and I'm comparing that to ibuprofen, and I'm ultimately measuring liver function. Okay, so those are the 4 components, and you can see it's written in a question, just like from the template. I'll show you an example where the time frame has been included. So if we look here for prognosis prediction, so for patients 65 years and older, that's my population of interest. How does the influenza vaccine, the intervention, compared to not receiving a vaccine, the comparison, influence the risk of developing pneumonia, that's my outcome, during the flu season? So that's the specific time frame that I'm interested in. So please take a read through all of these, and if you have any questions, we can certainly talk about them next class. Okay, so you'll also notice in your assignment, we want you to have a research question, but we also want you to identify a hypothesis if it's relevant, and certainly a variety of research aims or objectives. So we're going to talk about how those all sort of fit together. So at the front end, you have a sort of, a problem statement. And this is going to be very broad. And this essentially is going to look like what you guys discussed during the very first day of class when I asked you what your thesis topic was on. So you very generally gave me an idea of what you're interested in, sort of maybe what the question is, but very, very broad. What you want to do is you want to take that broad statement and you want to develop it into a PICO research question. So if we go back to the templates, you want to take that broad statement, identify all of your components of the research question, and plug it in to come up with a solid research question. And as you're executing your research, this is what you're going to be answering. When you have this research question, before you get going, you're going to generate a hypothesis. This is really a statement of what you think is going to happen when you do your research. And this is essentially what you're testing. So when we talk about doing statistical tests, it's really testing whether your hypothesis was true or not. So here's an example to sort of help you out. So here's an example of a very broad research topic. So some of you guys may have said on day one, my thesis is related to physical activity and cardiovascular disease. Okay, so I have a general idea of what you're interested in. I certainly don't know the specifics. I certainly don't know exactly what it is you're interested in. So you might have elaborated a little bit more and given me a more problem statement. So is there a link between physical activity and hypertension? All right, now I understand sort of what it is you're trying to get at, but I still am missing a lot of really important information. So this would not be a very good research question because I don't know who your population of interest is. I have an idea of generally what your intervention is. It's physical activity, but it's very, very general. And I do understand that your outcome is hypertension. So, okay, but is it causing hypertension or is it reducing hypertension? There's no specifics in this problem statement. So that's when, if you look down at the research question, all of those different components have been identified. And this one is sort of flipped around. You could rearrange this so that the P came first. But here we now know that the intervention is 30 minutes of moderate activity daily compared to absolutely no activity. Our outcome is reduced hypertension, and the population we're interested in is office workers. So that's the question. The hypothesis is going to be the statement of what you think is going to be true when you test this research question. So in this case, I think that after 30 minutes of moderate activity daily, sedentary workers are actually going to have lower blood pressure compared to those who did not exercise at all. So that is the hypothesis. I can actually go out and test this and see whether that is true or not. So the hypothesis is a clear statement about what you expect to find in your experiment. This is really central to most, but certainly not all, research that is out there. And it's essentially stating your research question in a form that can be tested, as I said. Your hypothesis should be clearly identified before an experiment is started. So one thing that sort of novice researchers do is they go ahead and they do their research, they look at the results, and then they tell me what their hypothesis was. That is not hypothesis-driven research. That is research-driven hypothesis writing. So that you should have an idea of what you think is going to happen beforehand, and that's based on previous experience, based on research that's been done by other groups, etc. So once you have a nice clear hypothesis, it's very easy to identify very specific research objectives. So these are action items, action statements that are going to help you determine whether your hypothesis is true or not. Right? And you're going to see a few examples of that in a second. If you go back to your statistics class, the null hypothesis is really the opposite of your hypothesis. It's what you're trying to disprove or reject. And often this is your null hypothesis is saying that any findings that you see are by chance alone, that there's really no association or there's no improvement, that anything you see is just strictly happening by chance. And really when you're doing statistical hypothesis testing, so in Module 4, you'll be talking a lot about this, what you're doing is you're trying to determine whether you can disprove the null hypothesis. So let's say we were talking about an intervention trial. So I was giving Group A one drug, and I gave Group B another drug, and I measured blood pressure at the end of the day. and I noticed that there was a difference between the blood pressures. So I ran a simple t-test to determine whether this difference in blood pressure was actually real or not. And I get a p-value of 0.05 when I run that t-test. What that's really telling me is that this difference that I observed, that 1 in 20 times, I will see that strictly due to chance alone. So 5% of the time, I would get this result even if it wasn't true. But 95% of the time, if I'm getting this result, it means that it is in fact true. So in science, what we typically use as a cutoff of what we say is sort of reasonable is a p of equal to or less than 0.05, or in some cases 0.01, so 5% or 1%. And if you get that, you can say that you can reject the null hypothesis, and that the hypothesis you stated was found to be statistically significantly true. So here's a very sort of dumbed down version of a hypothesis versus a null hypothesis. So let's say we made an observation that all of our socks were disappearing. I could come up with a hypothesis that aliens were coming into my house and stealing them. And the null hypothesis was that it was not aliens, that there's some other explanation for that. And so we would set up an experiment to test whether this hypothesis of aliens stealing my socks was true or not. So I mentioned earlier that in some cases, hypotheses are not part of the scientific process. Some types of experiments don't actually have a hypothesis. And that really depends on sort of the reasoning that's used to drive the research. So if you are using deductive reasoning in your research setting, where you are you're looking at sort of the world around you, you're looking at the theories that already exist, and from those, you're coming up with a research question and you're predicting what the answer might be, this is a hypothesis. And then from this hypothesis, you design your experiment. So this is deductive reasoning. And for the most part, all quantitative research is done in this fashion. However, some qualitative research is not done in this way. Instead, some qualitative research goes out and is actually making observations in a population, so asking about perspective, asking about experiences. From that information that they're collecting, they're coming up with some generalizations, and then developing a theory of human behavior, for example. And in this case, there is no hypothesis. So if that's the type of research that you are planning on doing for your grant proposal, certainly there is not a specific hypothesis associated with that. But we do want you to very clearly identify, if that is the case, that this isn't a hypothesis-driven study, and this is why. So regardless of whether you have a hypothesis or not, but certainly 100% if you have a hypothesis, you need to identify what your research objectives are. So these are very specific and accurate descriptions of the actions you're going to take to prove or disprove your hypothesis, or in the case of qualitative research, to develop the theory that you're working towards. The study objectives are going to define exactly what it is you're going to do during the study, and they should be stated in the introduction of your proposal or of your thesis proposal as well. So if we go back to this example where we have our research topic of physical activity and cardiovascular disease, we narrowed down to a pretty specific research question with a hypothesis. Remember, our hypothesis was that 30 minutes of exercise in sedentary workers will reduce blood pressure. So what is my objective? How am I going to prove or disprove this hypothesis? Well, I'm going to perform daily blood pressure measurements on these two groups of patients that are randomized to this group or this group. I'm very specifically telling the reader what it is I'm going to do to determine whether this is true or not. I've also put here just an example for you to take a look at. So this is from a grant that I have submitted previously to give you a sense of how you might want to structure this and how you might want to think about this, again, from both your thesis proposal and for your grant proposal. Where at the outset, I'm sort of setting the rationale. So what is the problem that we're talking about here? What's the gap in knowledge? I very clearly identify a hypothesis, and I usually try and bold it and italicize it. And then as I move down, I very clearly delineate my research objectives. And I make it as obvious as possible. So remember I talked about these being action items? I try and start my sentence with a verb, so an action word, and I very clearly delineate what that action word is. So my objectives are to develop a histopathology antibody panel, to validate this panel, and to evaluate its clinical utility. So those are the three sort of objectives I was setting out to do in this grant, for example. Okay, so if this was an in-class lecture, what I was going to get you guys to do at this point was to break off into groups with some of your peers and to start talking about the articles that you guys had selected for the first assignment, so those interdisciplinary research articles. So what I would do if I were you, it's totally up to you, is to try and reach out to some classmates and maybe try and do this and if you're comfortable doing that. If you would rather just do this on your own, certainly these are the things you need to be looking for. So in the papers that you've found, I want you to really read it and understand what the gap of knowledge is that's being studied by this, addressed by this study. Can you identify a solid research question? It's important to note that not everybody in a research paper will actually identify the research question. They should very clearly identify the hypothesis, but not everybody actually spells out the research question. But you should be able to identify it. So look for who the patient or the problem is. What's the intervention? Is there a comparison? What's the outcome of interest? What's the hypothesis, if there is one? Do they identify what the research objectives are? And if so, what are they? And why do you think this is interdisciplinary? Or maybe it's multidisciplinary. And what does that actually mean? So I want you to sort of think about that and start generating some of that thought. The other thing that I want you guys to really start working on now, if you haven't already, is your assignment 2. So this is the beginning of that grant that you're going to be working on. This is going to be, again, a joint assignment for both HSS5901 and HSS5902. The things that you should be capable of doing at this point in relation to that project is coming up with a research problem, a research question, a hypothesis, and your research objectives. So this lecture is really giving you the foundation to be able to start working on those pieces of that assignment. Just to remind you that this assignment is worth a lot. So 80% of your mark here in 5902. I'm not entirely certain how much of your mark for Module 1 it is in 5901. You'll have to ask Isabel about that. This is one assignment that you're going to send both to myself and Isabel. And then each of us is going to take different sections that you can see here to grade. So I am going to be grading your hypothesis and your research objectives and your research design and your research methods. And that's really what the topic is for the next lecture that we are going to have next week. So these are the instructions that you have in your syllabus and online about what it is that I'm looking for in regards to your hypothesis and objectives, as well as your research methods. So please read through those and read through how I'm going to be giving you grades for these different sections so that you make sure that you're answering all the appropriate questions. And that is it for today's lecture. So I will see you guys next week and we will talk about research methods at that time.